This podcast is for general informational, educational purposes only and is not to be considered medical advice for any particular patient. Clinicians must rely on their own informed clinical judgments when making recommendations for their patients. Welcome, everybody, to another episode of PHM from Pittsburgh. I am still your host, Dr. Tony Tarchichi. In case you're new to the program, I'm a med-peds-trained pediatric hospitalist here at UPMC Children's Hospital of Pittsburgh in the Paul C. Gaffney Division of Pediatric Hospital Medicine. We are here at PHM21, just wrapping up day 2, and man, what a day it was. If you're listening, just to be clear, this is not a CME-associated podcast episode. We are doing non-CME right now. This is our What I Learned at PHM Day 2. We are fortunate enough today to have 3 of our community hospitals who volunteered their time, which I really appreciate, to be on the show to talk about Day 2. I thought it was a tremendous success, but we'll get to that in a second. You know who I am. Let me introduce our guests. I'm going to start with Dr. Faughnan, and we're going to go to Dr. Miller and Dr. Chiu. So, Dr. Faughnan, if you wouldn't mind.
Thanks so much for having us. My name's Meg Faughnan. I'm a pediatric community hospitalist. I technically work for Stanford, but I've worked in a community hospital in San Francisco for the past 10 or 11 years. I guess I've just crossed over into the 11th year. I have a couple of administrative roles in our hospital, and I'm excited to be here.
So are we. Dr. Miller, you're up.
Awesome. Thank you again for having us. So I'm Deana Miller. I'm a pediatric community hospitalist in Wilmington, North Carolina, out on the beach. And I've been in practice, I guess, 7 years now there. So,
well, thank you for coming. Dr. Chiu.
Hi, my name is Dr. Lingie Chiu, and I'm also currently working as a pediatric hospitalist. I also do some outpatient work. I work between the states of Hawaii and in California, and actually grew up in Pittsburgh. Was one of the few Asians actually that grew up in Pittsburgh in the 80s. And so, I feel like a lot of the talks today really resonated with me. And when I heard the Tonys from Pittsburgh, I decided, okay, let me volunteer, even though I'm on call. So.
Well, you're on call. Well, any Pittsburgh native is welcome on the podcast. Thank you very much. So why don't we start? I'll go first, and we'll kick it out to Meg, and then Deana, and then Lingie. Give us your favorite part of today in terms of everything we saw. And right off the bat, I'm going to tell you, everyone who's listened to this knows I'm not biased. I guess I am biased about this. I love Dr. Fauci and Dr. Beers. I thought it was a great conversation. It was 30 minutes, excellent questions that were asked. I love their responses. I genuinely enjoyed it. He talked about, if you're going to listen to it later, I don't want to spoil it for you, but he talked about the difference in the R0 in the Delta strain versus the Alpha strain of COVID. He talked about our terrible winter, or terrible summer with all the wintertime viruses that we're having. And he was very honest that he didn't really understand it or know it's first time it's happened, which we've talked about in the podcast before. But we'll get to everyone else before I could go on and on about this. Meg, you're up next.
Yeah, I really loved hearing from Dr. Fauci. It was nice to hear him speak to a physician audience. I think we got a little bit of a different bent from him. But I have to say the highlights of my day were hearing from Dr. Silver, the plenary speaker today. I think maybe it's because I'm a woman, but I think it was because she was a truly remarkable speaker, and she really touched on a lot of things that hit a nerve with me. And I actually really enjoyed a lot of the workshops today, too. I liked the breaking out into small groups, and I would call out the workshop which followed Dr. Silver's talk on being a working parent in PHM. I thought that was pretty great, and a lot of great ideas bounced around there.
Oh, we're going to definitely bring that up. Deana.
So I would agree. Dr. Fauci was amazing. And even my children were fairly quiet during it, so I could hear well. They understood there needed to be respect for that. Dr. Silver was good as well. I also wanted to shout out Dr. Chomillo, I think is how you say his name. He talked about racism as a pediatric public health crisis and moving from awareness to action. And I thought he had some really good take-home points and things to actually do. I'm excited to check out the Early Risers podcast he brought up. I'm a huge podcast listener, including yours, Tony.
Thank you.
And so I think that was good. Also, lots of really good workshops today. And I also am in charge of the clinical conundrums with Lisa Herman. And so I hosted one of those today, moderated them, and It's always amazing to me, the crazy cases that people present and how well they present them. The residents did great today, and lots of good questions. So.
Yeah, there's always full confidentiality. I am on the PHM planning committee, so when I know it's a little bit self-serving when I compliment the conference, but I did think it was well. That being said, I'm sorry for interrupting. Lingie, you're up.
No worries. Thank you. Yeah, definitely. I appreciated that I got a chance to actually listen to Dr. Fauci and Dr. Beer speak for their 30 minutes just a little bit ago. And then I think for me, the highlight though was just learning new things, like just learning. I got a chance to listen to Don't Bloat Your Note for the documentation workshop. And I think that really resonated with me because I have a new family medicine resident. She's an intern and she's with me now. And this is her first 2 weeks. And then she shared with me, she actually has not gotten any inpatient minus 2 weeks in medical school because of COVID. And then that just occurred to me that, wow, the new folks who are teaching, we're teaching folks that kind of doing a new thing too, a hybrid. She hasn't gotten a chance to touch patients much at all because of COVID. And then now she's coming in as an intern and to kind of, how do we educate them? And this kind of resonates with me because I'm like, my third year of medical school was actually, my first day was orientation. Second day was 9/11/2001 in New York City, having grown up in Pittsburgh. And it reminded me how hard I worked to get where I am now. And then listening to the racism talk, I think that also added to it because with everything going on, being an Asian, growing up in Pittsburgh, it's like, okay, now with this new generation, how do we be patient? How do we teach? And this documentation workshop was so scientifically based. I'm like, who knew? I didn't know, actually. I'm sure others did, that they had evidence based behind how to best review and teach interns how to document and how not to bloat their notes. Because I did notice that. And I'm like, okay, I feel for her. How do I kindly give her feedback in a gentle way on how to not have every day's notes summarized and added on? And I felt that documentation workshop did a really good job. Unexpected. I wasn't expecting such a good talk. So.
Well, you bring up 3 or 4 excellent points. I mean, the first clearly is COVID has affected the current intern class. When they were I had a similar experience with an intern. Won't give too many details, but there was significant parts of the physical exam they had not done because of COVID. They were third years in a program where there wasn't a strong inpatient rotation for their third year. Then during their fourth year, they were home the entire time. And so they came to us with significant deficiencies in their physical exam abilities on kids specifically. So we had to make that up during when they were visiting us. But it's an interesting experience, which I've never had before. And I don't know, I kind of hope we never have again in our careers in terms of having to deal with it. But thank you very much, Lingie. That was great. So where should we start? Should we start with Dr. Silver's plenary? Because I thought she talked about, for those who didn't listen, if you're listening to the podcast, she talked about gender equity in medicine, and specifically pediatrics. She gave a lot of great data. And it's one of the things I loved about her talk is she gave so much information in terms of data that on papers she was a part of, but they were excellent papers nonetheless. And then she gave practical experience from her life in terms of ways to help, ways to be an ally, but not be patronizing or not be ineffectual, right? So I don't know, Meg, did you feel the same way?
Yeah, I've heard Nancy Spector speak, and I think she is, similar vein and similar body of work. I think that they work together and probably emulate one another, and both strike me as really remarkable women. The thing that she said that struck a chord with me, because I really think of myself as a feminist, and I do see so much inequity in the workplace, and I don't do as good of a job as I'd like to calling it out, but I do recognize it as a woman all the time. The thing that she said that I never really get upset about, that I'm now totally pissed about, is the line outside of ladies' rooms. That she said it's true. Some of these things are just tiny, and they shouldn't actually exist, and they're easy fixes. And we've sort of let it go on for so long that it's just become our new expectation. I definitely experienced that as a nursing mom, to have to ask for places to pump, even at Stanford. So you would think they would be, beautiful facilities, have tons of pumping rooms, and that was not the case. And so a lot of what she said resonated with me. And I think I really appreciate that she will only now speak to larger audiences, because women know this. And I think you have to get it out to men to make a difference.
Yeah, that struck me because, and Lingie will know this from being from Pittsburgh, but the Benedum is where we do a lot of, where Pittsburgh gets a lot of their off-Broadway plays, and there's always a line there. And I never thought about it, but I mean, to get more plumbing up there, I don't know how you would do it. But that was a very interesting point. And it was one of those practical points she threw into a medical talk where it just made you realize, oh, that's common sense. I recognize that. I've been in stadiums. I've been in plays. I see that. Deana, anything to add?
Yeah, I think even just going along with what you were saying about breastfeeding room, I liked how she said, like, we don't need to get big committees together to think through better ways to do this. We just need to do it. Just make more rooms. Like, don't waste everyone's time. And I liked how she talked about a lot of times that women are the ones that sit on all these committees and volunteer their time to do all of that when really, someone higher up is getting paid for it, but it's not these committees of women that are really doing all the work. She also made the comment about the fourth shift, which I thought was really interesting, where I wrote down all the shifts because I knew I would get confused or forget. But your first shift is your job. The second shift is like women generally are doing more things around their home. The third is then all the work that women do with gender equity. And then the fourth is now all of the work that we're doing with COVID. And that, there's lots of volunteering to give out vaccines and doing all those sorts of things. And just that there's lots of volunteering and loss of pay or loss of time that you could be making money and things doing all these things. So yeah, I thought she had a really great talk.
Lingie, anything you want to add about Dr. Silver's talk?
You know what? I sadly did not get a chance to catch it. I was on call and I was multitasking. But one of the ways I started today was actually with coffee talk with PHM leadership. And that was actually one of the conversation pieces that we had during the coffee time. And one of the things that actually I appreciated when Dr. Walker, actually, who we got the privilege of spending a little coffee time with this morning, was that she spoke about her own personal marriage and difficulties with children. But then I also threw in a message question. It's like, how is your group also supporting the single females? Because for me, it's been a very interesting thing. I feel like I connect with a lot of OBs as a peds hospitalist because when we're on call, we're often working with the OBs. And then for me, I thought I'd always been married by this time and I haven't. So I feel like I'm oftentimes a single female that people ask questions to. And then under the assumption, oftentimes I do take extra call for folks I take through the years, and then how to stand up for ourselves, advocate for ourselves, that we too also need time to recoup. And I appreciate what she shared this morning, the things that they're doing to provide support to also their single colleagues, not only the ones with children and even their single females. And that aspect I was very impressed with, that she had an answer. They are doing things. They're meeting once a week, even virtually via Zoom throughout the whole pandemic in order to support each other through the pandemic, even as colleagues. And I thought that was really great, and to promote the wellness amongst the peers, no matter what your situation.
I will say Jackie Walker out in Kansas, she's a wonderful pediatric hospitalist. She's the program director out there. She's a lot of leadership positions in PHM. I think if you talk to her, you're in good hands. She really is a great mentor. And I think you're right. That's one of the things we've talked about in Pittsburgh a fair bit, is a lot of people focus on those of us who have kids, to be home with the kids, et cetera. But everybody needs support. Everybody needs help, because the pandemic has been hard on everybody. It's hard to be alone. And at least, with when you have kids and a spouse at home, you have some people to go home to. When you go home you're alone and you can't go out because all the restaurants are closed and all the bars are closed and all your usual sources of companionship with people are shut down. That's hard. That's hard for everybody. Thank you, Lingie. Now, can we talk? I apologize for this. I forget the name of our first plenary speaker. So one of you brought it up. Does it remember the name?
Yeah, it was Nathan Chamillo. I apologize in advance for mispronouncing his name.
Thank you. Deana, I do that all the time, so we'll apologize all the way around in case we mispronounce his name. But I will say, to Lingie's point, if you missed anything today and you, of course, pay for the conference, you can always watch it later. So, for instance, Dr. Silver's plenary, I would say definitely watch. I thought that was very much worth it. She brings up a lot of good literature. It's good to have around if you're in pediatric hospital medicine. Dr. Shamila's talk was excellent. He really talked a lot about racism in medicine and kind of the history of it and how it's affected people. And he talked about the pandemic. And I really thought he did just a very nice job highlighting the points of how racism is a healthcare issue. It's a healthcare crisis issue. We'll go around the horn. Meg, what did you pick up from it?
Well, I think, let me see if I have notes from his talk. I don't know if I did. I wrote down, or I scribbled down in my other notebook, a couple of things to go over with my kids. So I thought that was really helpful. And I really liked how he talked about talking to kids about racism and, to try to be as honest and not sugarcoat things as much as possible and not to talk down to them. I think that especially in subject areas that make us a little bit uncomfortable or we feel uncertain about the correct thing to say, we often do. And also he pointed out when we feel embarrassed about things that kids have said or we kind of want to shush them and talk about it later, but it's important to just address it in the moment. And I thought that was a really well taken point.
Okay. And Deana.
So I thought, even one of his opening slides, he showed postnatal infant deaths due to diarrhea and pneumonia somewhere in the South. I forget which state, but it showed blacks versus whites, and whites was like a low line and blacks was very high, and then dropped precipitously in 1965, but still was higher, and asked what that was. And, then it was Medicare and Medicaid being put into place, which I thought was really interesting. And then the way he then went from there to modern day and showed maps of where COVID is bad and where Medicaid expansion hasn't happened yet. And kind of just comparing all of that to show that even though we think we've come so far, there's still all the same systemic racism problems that we're seeing across the country. So, and then I agree with Meg too, that all of the talking about race with your kids, I wrote down some good websites and resources he offered. So I'll definitely be checking all those out.
Those are nice things to have for parents.
Yes, I will say some of those books, and I won't take any credit. My wife researches all of this. We have read some of those books with our kids, and I was very happy to see them up there. And by we, I mean she has read some of those books with our kids. But it was nice that he talked to us about what we can tell our pediatric patients and our kids at home, books we can read, things we can go over and discuss this with. I thought, again, really good foundational science to discuss all this on, and then really good specific things we can do.
Yeah, his is a talk I have to go back and catch some pieces of because the time difference, that was breakfast time here, and so I missed some pieces.
Yes, being on the West Coast, that's true. Now, Meg, you mentioned a workshop you went to that I said we want to circle back to. What was the workshop
I went to two workshops today that I really liked. One was on parenthood in being a parent in PHM, and people shared a lot of personal stories and talked about how you can make systemic changes to support each other and working parents in PHM. But to Lingie's point, it also comes back to supporting people and recognizing everyone's needs.
And speaking of which, if you're listening, Lingie is on call, and she got a phone call, so she is dealing with a patient care issue. So we may not be hearing her until she gets back. So just please don't think we're ignoring her. But we're supporting her through this as we do with everybody. These things happen in medicine. We're going to roll right with it. Deana, did you go to that workshop, or what workshop did you go to?
Unfortunately, I didn't. I actually hosted, or I didn't host. I was part of a workshop today. This morning about perioperative medicine for the medically complex children with Dr. Milani was the host of that. And then I also did the clinical conundrums. So I was talking a lot more today, but I'm sad that I can't go back to some of those workshops because like the note bloat one looked really good and the parenting one looked really good. There was a couple that there's just too much good stuff.
I also went to the imposter one, and that one I thought was really well done, but also got interrupted by some home stuff.
So the workshops, you can watch them all later. You just can't go to the private small group sessions that they went to. But you can watch the before and after parts later because you ordered the conference. But I did the one you went to, Meg. Did they give any good tips for parents who are working in pediatric hospital medicine?
So the take-home points that I think I've heard other places, but it was nice to hear from colleagues, were to sometimes it's okay to dig into work, and sometimes it's okay to pull back and dig into home and to try to figure out what your limits are. I personally am on call 24 hours a day for administrative stuff for my hospital. And people brought that up as something that was not doable. But I think in some positions, it has to be. And so to draw your lines where you need them to be. And I liked that they didn't just say, pull back and be at home when you need to. They recognized that sometimes you need to dive into work. And it was nice because sometimes I do that. I'm sorry, it's patient care and Dad's got to deal with it right now.
I mean, that sounds reasonable. I mean, I went to the allyship workshop, and I forget that everyone who ran. I know Barrett Fermi was part of the group that ran it, and I thought that was excellent. It gave a lot of examples on how you can be an ally for gender equity in the workplace. It talked about the pay gap. It talked about the gap in terms of what's expected to be done. Like Barrett brought up a couple times that even in any type of meeting, whether it's an executive meeting or whatever, traditionally it's the women who are the secretarial role in terms of writing the notes for the meeting. So we tried to make it that the men did it for this time. But anything you can do in order to be an ally, there were a number of cases they brought up with animated with specific skits and how would you respond. So that was helpful to see. Overall, it seemed to be a day of gender equity and racism in medicine, capped off by Fauci. But I thought overall it was a really nice day, hitting on important topics, doing it in creative ways. Deana, how did your workshops go?
They went really well, actually. I was very nervous. Meg and I did one together yesterday about community hospital medicine. And then I had another today. So I'm happy to say I'm on the other side of my workshops now. But I think virtually I was very nervous about the breakout rooms and all of that. And it all went really smoothly. And I think we had lots of really good conversations, and hopefully people learn things. I learned things from my participants even. So I thought they went really well.
Now, I will say I have 3 community hospitalists on. One of the things I come to this conference for is networking. Now, there's a lot of people I see year after year, and it's nice to catch up. It's for looking for ideas for our fellows in Pittsburgh and or for our division, whether it's in perioperative medicine or newborn medicine or whatever the case may be. Is it any different? And I assume no, but I'm just going to ask because I don't know 100%. For community hospitals, do you all come here for more clinical information, or do you come here for the same kind of things? We'll start with Meg, Deana. Actually, Lingie's back. Lingie, we'll start with you, then Meg, then Deana.
I think for me, I always love the networking, but I think for the networking, I like the AAP and NCE. So I go there annually. But then for the PHM, I think it is a lot of the clinical updates because so much has changed. Because I finished residency in 2007, and there's been a lot, and it was a big children's hospital. But then it's been so long. There's been so many changes the last 4 years. And I feel like with all the changes that's occurring every year, I feel like it's just been really good for me to come every year. And I can see the difference the years, my colleagues who come and the colleagues who choose to skip every now and then, the difference, because there's just been so much research. And I feel like what I appreciate, though, I do try to make an active effort to stay in touch with academic centers, to stay in touch. But it's more challenging since working in the community hospitals. So I do try to work. Right now I'm blessed, though. I actually do 70% of the community hospitals, and then I moonlight 25%. So I try to come up with my own schedule, and that's been a blessing to be able to travel and to try to keep things updated. But I have to say that I do enjoy the networking. It was a blessing to do coffee talk, I think, yesterday morning with Magna, and listening to her community hospitalist experience over in the East Coast, which is definitely a lot different than on the West Coast. So it's been cool.
Well, thank you. Meg, you're up.
I think when I started coming to PHM, I started working clinically in 2010 or 2011. And then it was more for the clinical knowledge. And now I think I come more for the networking. On typical years in person, there's a community hospital day, hospitalist day or half day session before the full PHM. And actually, I always look forward to that quite a bit. And Deana and I have been working on some community hospitalist stuff just on an ongoing basis. So it would have been nice to see people that I have Zoom calls with in person. But they did a nice job with Pathable this year.
Now, Meg, before we go to Deana, Deana said she's done for the day for the conference in terms of talks. Are you done as well?
I'm done. Yes.
Okay, so you get to enjoy it from here on in.
Mm-hmm. Yeah.
All right.
The butterflies are gone.
Deana, you're up.
I think I agree with everyone. I think initially it was definitely more clinical. Now I enjoy all the networking. It is a bummer. We were just my group today that presented. We were all texting back and forth and sad that we couldn't go out to dinner tonight at a swanky restaurant and have drinks. This is my first year presenting, and I it's all people that I've never met in person, actually, that I presented with, including I led a group of there's 10 of us for our community hospital presentation. And I've never met any of those people in person, but we've met on Zoom so many times. Meg can attest, lots of emails. So I hope one day we can all get together and actually meet in person, hopefully next year, and have drinks and just see everyone. Because I think the networking is definitely the fun part. And it's fun to get away from your children when you can travel.
Yeah, I feel like I'm more dedicated. At first, I just moved to a new place. I'm in my basement right now. We just moved a week and a half ago. And so going to the conference is always kind of difficult, working it around shifts and then having to make up shifts when you come back. But at least when you're there, it's dedicated time. And now, we've been holding the pager for people who are presenting because they're still on a clinical shift. And it's a little different.
It is there. I've said on the podcast before, I'm not a huge fan of traveling, but I will say you're right. The parts when you finally get there, after you've done the airport and the cab from the airport to the hotel, and you're there, meeting up with old friends and old colleagues and going out to dinner, it's always nice. That's never bad. And then, of course, I have 3 kids, so getting away when I can. The past couple, my kids have come with me because they wanted to see Seattle and they wanted to see Atlanta, so I did not get away. But besides that, it's always fun. And we didn't even bring up the a fever and a neonate, kids under 60 days of life updates. That was today.
Shocked.
I couldn't get in. It was full.
Yeah. Was it full?
It filled up. I couldn't get in. So I was a little bit bummed, especially because Ken Roberts and I actually did our other presentation yesterday together. So
Is that right?
I thought he'd have my in, but I heard him speak about it previously at another conference. And so I'm excited to listen to the recording.
The first 17 or 18 minutes was them setting up why it took so long for the new guidelines to come out and how they got the committees together and kind of the infrastructure. And then the rest of it was the changes that were made, which they did go through. So that was really interesting. I mean, it takes a long time. They compared themselves to the Constitution a lot in terms of ratifying the Constitution, which I thought was very funny. But it was... it's a brand new guidelines. There's a lot of changes. We are going to talk about them on the podcast, I think within the next month or so, but it was a good day. I would overall say a good day, capped off with Fauci and Dr. Beers. So you really can't go wrong. We've already 29 minutes in. I don't want to take up more of your times. We'll go around the horn. You can mention anything else that we didn't bring up that you really liked about today or anything you want. We'll start with Meg, then Deana, then Lingie. And then we'll cap off the day. And again, thank you so much for coming.
I think I'm sad that I didn't get into the fever and a neonate talk as well. Although I did hear a couple of the guidelines discussed yesterday in the which one was it? The safely doing less talk from yesterday. And I have the benefit of working with Francisco Alvarez, who's been hinting at all of the changes for a long time. He also hints about the hyperbilly ones coming out hopefully this winter. I heard December of this year or early January. But I think those guidelines take forever. And so we've sort of implemented some of them slowly, even though they haven't been formally released. And so that it'll be nice to ease that tension. And the other talk that I thought was really interesting was the imposter. I think they're not calling imposter phenomenon, not syndrome, but imposter phenomenon talk. I thought was pretty good. I even feel like an imposter on this podcast. Like, what do I have to say that you really didn't know from the day? And so, that one was really nice. Great.
Meg, I will say you've been at all the sessions I didn't go to, so I'm very happy you're here. I am very, very, because you went to the exact opposite ones I did, so it was great to have your perspective. Thank you. Deana, you're up.
Another one I forgot I'd gone to actually was Getting to the Heart of the Matter, which was the cardiology workshop.
Oh, how was that?
It was actually really good. I feel like often when you go to these cardiology workshops, it's like the same things over and over again and like tons of reading EKGs, which is not my favorite thing to do and just not it. But they actually hit on different things. Like in the arrhythmia section, they talked about how do you determine if it's artifact or real and kind of gave a really quick 3-step checklist for that. They talked about junctional bradycardia. Like they talked about things that aren't the typical, which was nice. So I thought they did a really good job with all of that. And it was very interactive with your poll everywhere. If you could get that to work. So it was really cool. And then I'm going to give a shout out too to the posters, which again, I am biased because I helped select all of those. But the poster sessions I think are really good. If you can log in at 12:30 Eastern time, you can actually talk to people if you want. Everyone's standing by or sitting by their poster. Basically, it's just a little awkward at first. But if you get over that and just log in, you can talk to someone and they can tell you about their poster. It's really cool. And there was a ton that I didn't get to talk to everyone about today, but was able to read them all. And they're really amazingly well done. One was looking at clinical outcomes of newborns born to mothers from Yale that had COVID and just, which babies developed COVID or not and all of that. There was one about from, I think, Ontario looking at virtual family-centered rounds and then all of the clinical conundrum type cases that are posters. I mean, there's just a ton of cool stuff to see.
Well, Deana, before we get to Lingie, I will say thank you for being a part of those who were selecting the posters, because I agree. The posters were excellent this year. There was a lot of really good information out there, and that's one of the things I love about our conference, that there's such good research that goes on. So thank you. Lingie, you're up. What did you like about today that we didn't talk about? You missed some of it. We talked about the plenary sessions, but any workshops or anything you went to that you really liked?
Yeah, I also went to the cardiology, and that was a very good talk. I did enjoy it, especially as a community physician and not having a cardiologist on site. It's a good refresher. It's been a lot of years since I've had a cardiology inpatient rotation, so I appreciated that. And then I think, just as you guys mentioned, it's been kind of cool because I feel like we're connecting with different people. Like if I was in person, there's certain people that I probably would connect with, and then it's kind of cool in this virtual setting. I did not get a chance to attend PHM virtual last year. And then my first PHM was just the year before. So this is only my second PHM. So yeah, so it's been fun. So thank you for having me here.
Hey, it was, you know what? It was absolutely my pleasure. Lingie, Meg, Deana, thank you so much, all three of you, for joining the show. I really appreciate you being on. Really appreciate your time. Thank you.
Thank you. It's been fun.
And I'll see you throughout the rest of tomorrow. I hope you have a great day. I'm sure tomorrow's going to be as good as today. We've had 2 great days.
Oh, can I add one more plug that I thought
Sure.
about? The Suck, Swallow, Breathe was also a really great talk. I really liked that it was run a lot by some speech therapists. So it's really nice to see that multidisciplinary team put together. And I thought that added a lot. So anyway, another one I thought was good.
For those of you at home, if you ordered the PHM21, you can see any of these. I was there for today, and I missed almost everything Meg went to, half of what Deana went to, and some of what Lingie went to. So I'm going to go back and watch them. But thank you all again. This has been wonderful. Hope you have a great tomorrow, and then have a great weekend. And now it's time for some acknowledgments. We want to thank the University of Pittsburgh, who normally sponsors CME credit for anyone who listens to our podcast. We want to thank UPMC Children's Hospital of Pittsburgh, and specifically the Paul C. Gaffney Division of Pediatric Hospital Medicine. I want to thank our guests again who came on. I really appreciate your time. Thank you for coming on. It was a lot of fun. And I want to, as always, thank Dr. Meg McKean-Tarchichi, who helps me with everything. You all have a great rest of your conference, and I'll see you tomorrow.
Thank you for listening.